Good afternoon, everybody. Thanks for being here. We certainly know the air conditioning works at the On-Center complex today. Very brisk in here. Good news, no new deaths over the weekend. Very good news as we continue to learn how to treat this virus better. Reminder, we've lost 204 neighbors over the course of the pandemic. Certainly we'll continue to think of them. Looking at testing, Friday through Sunday, diagnostic tests, over 6,300 done in Onondaga County, 7-day rolling average, 0.8. Again, as data comes out, we're tracking it pretty specific to our county. A little bit of a difference with the state's website with how they report. There's days where the number of positive tests the state reports are different from ours. Obviously, our data is a little bit better because we're the ones who do all the contact tracing and get all the cases. Sometimes via that system, some cases in other counties get reported under our data, and other days you may have duplicates of people who are waiting a negative test that get reported. So very close, but we have the most accurate data related to our county. In addition to the diagnostic tests, we have not factored in the over 18,000 saliva tests that have been done. Certainly, if we factored those in, with the super majority of them being negative, that infection rate would be way down. The positives do go into, the positives become, out of the saliva, become a positive in our numbers. So out of the 0.8, we do have positives from the saliva pool testing that's been done at the universities, but the negative tests do not factor in. Looking at hospitalizations, we now have 16 individuals in the hospital. That's down one from yesterday. 1 individual is in the ICU. Out of the, who's in the hospital, 13 Caucasian, 1 Asian, and 2 patients who have not given us the demographic data. We've had 3,763 positive cases since the pandemic started, 15 new cases since yesterday. 1 travel related to Virginia, 4 household contacts of previously confirmed cases, 2 are still being contact traced to the origin. 4 community transmission. Out of the 4 community spread, I believe we have 4 that we know the source. Actually, we have 6 that we know the source. So out of the 8, 6 are known. And currently we are monitoring 169 active cases. This is down 6 from yesterday. And we have 3,395 of our neighbors who have recovered since the pandemic started. That's up 21 from the day. This is an interesting graph. Again, the red are positive cases. The greens are recoveries. The yellow are active cases. And the gray are the neighbors that we've lost during the pandemic. And so you can see the progress we've made. And so certainly, if you think back to the mid-March, March 25th, really when things got started getting very aggressive with hospital numbers, and you look at where we are, if you said we were under 1% infection rate, positive rate in September, it'd be interesting where everybody thinks that would look like. Think about that, reflect on that. But certainly we've seen a tremendous amount of progress. We've now welcomed back in close to 20,000 students in our community. We've seen no spikes. Why? Because our colleges did what others didn't do and put the time and invested the money to do testing, working with us on testing protocols. There wasn't an Onondaga situation. There wasn't a North Carolina situation. We tested these kids coming in. We tested again since they've been here, and we continue to test them now being here. And we continue to see very, very low transmission on campuses right now. So it's been a remarkable start. And we're taking the same program that we did with our colleges, and we're doing it with back-to-school testing as well. When you look at who's been impacted by the virus, 2,161 female, 1,602 male, 332 under 19, 755 in their 20s, 501 in their 30s, 451 in their 40s, 560 in their 50s, 424 in their 60s, 308 in their 70s, 272 in their 80s, 160 in their 90s. Our back-to-school testing had our first week last week. Over 500 staff tested to date, no positives. Again, for those districts that have not gone yet, please go to our health department website to register. Today we are at ESM High School for both the ESM and Lincourt school districts testing. Tomorrow we will test at Jordan Elbridge, Skinny Atlas, and Marcellus at Marcellus High School. So Jordan Elbridge, Skinny Atlas, Marcellus at Marcellus High School tomorrow. And then I'll go over some future sites here as well. This Wednesday, Baldwinsville High School. Thursday, West Hill and Solve at West Hill High School. The Syracuse Catholic Diocese in Jawonio at Bishop Ludden Junior Senior High School. Friday, September 4th, Cicero North Syracuse at North Syracuse Junior High. Tuesday, September 8th, the West Genesee School District at West Genesee High School. Wednesday, September 9th, Fayetteville Manlius District at Fayetteville Manlius High School. Thursday, September 10th, Liverpool at Wetzel Elementary School. And Friday, we will have an open testing day at NBT Bank Stadium, where we'll have our partners there. My office will be helping to staff that as well. And then the Syracuse City District has finalized their plans. We'll finalize our testing schedule, which is likely to happen next week for the city school district employees. So a lot of logistics, a lot of work, but we'll take the lessons learned from college and we're going to apply it here for faculty. Then we'll work on students, especially our high school students, and we will continue to hopefully see a lot of success with that. Something I just want to highlight today. Today is Overdose Awareness Day. Today I was trained on how to administer naloxone or Narcan. The addiction in the community isn't going away in a pandemic. It's just gotten worse. So certainly we've partnered with the Prevention Network. Today, it started already from 3 to 7. Anybody can go and learn how to get Narcan and also get some Narcan. Between those hours, it's a short training, but it could save a life. So it could be a family member, it could be a stranger, it could be a neighbor. So please, we've done a great job taking care of each other during the pandemic. This is another way we can all become better citizens. So I want to thank our partners with that. Saying that, happy to take questions on the data or off topics.
Just on what you said, is the problem directly related to COVID, that overdoses got worse, or is it just that the attention and resources may have been diverted?
I think it's too early to tell if it's directly related. I think it certainly, there's a strong rational argument that due to the stress that the pandemic brought, limiting liberties, that none of us have been here before, right? It impacts us all a little differently. So certainly if you're an addict and you're put in these types of situations, a recovering addict, these are all pressures. So I think we'll know more as time goes on, but we do know that this has been a problem in all communities. It continues to be a problem in not just our community, but across the country. So, this is another initiative with our health department, the Prevention Network, that we can try to become stronger and really address another public health issue that has been at a crisis level for many, many families for a long period of time.
Ryan, you mentioned that we don't have an Onondaga type situation here. Do I understand right that if there are 100 active cases on campus, they have to close regardless of how big the school is and what kind of percentage of student
is? So we're getting a little clarification on that. We believe it's 100 over 2 weeks.
100 positive cases over 2 weeks.
In 2 weeks. That's what we believe. We're going to get clarification on that. To your point, Tim, you can think, if you do the math, I'm sure somebody's got a calculator, but 100 cases over 18,000 students at SU is probably a better infection rate than Onondaga County or New York State has. So it's kind of a tough argument to make that that school should be shut down because of that. And so we'll have those discussions with the state once we understand the guidance a little more. I think if you have a spike with 100, again, the EO, the order, I think gives the health department, both at the state and local level, different discretions on that. We work with Syracuse University every day. They would be the ones that 100 cases, we wouldn't sound the alarm button because of how many students they have. Some of our smaller colleges, 100 compared to 3,000 students or 4,000, 2,000, it's a little different. But we're looking at it to date. This is not even an issue right now compared when we look at our data with all of our colleges since we've had them all back related to the testing that we've done and then the sampling that we've had. I think we have 29 cases out of 5 colleges. So again, that might be worth in our 7-day average 0.12 or 0.10. So the nice thing is we've, and again, I think I talked about this a little bit last week. We had some events that led to clusters of cases. And so if you, just in the past, what we've seen is you have these clusters, you have about 10 days worth of cases from it, and then things get back to what your normal community transmission has been if we do a nice job boxing in the virus, which we have. So if you really look at our ability, our infection rate got to the point with our positive rate where it got so low that we're able to absorb a couple clusters over the last 2 weeks and bring back all the college kids to campus. And really, we didn't go anywhere, maybe a little bit higher.
I know there is some concern among community residents about the colleges because kids come from everywhere and because they're kids. What would be a trigger at SU, do you think, to start looking at closing?
Well, I think if the governor's guidance is 100 at 2 weeks, if that's what it is, we probably think it's that's pretty aggressive, but I think that would certainly trigger the conversation. And right now, we've been here 2 weeks. We started out, I think, under 20 at SU. So week one, if you think about this, and again, a lot can change, but if you think about it, the most risk of kids coming in and bringing it in would be right when they came. But because we tested and those who are positive were caught in their hometowns, they quarantined in their hometowns and recovered. So they're coming into a community that had an infection rate of under 1. Now, very few tests out of the 18,000, very few positives. So a lot can change, but they're coming into a very safe community. One can argue those students are safer here than they were in their hometowns, many of them. So I feel really good where we are today.
Tomorrow, your proposal for layoffs goes before the legislature. Wondering if you have a clearer picture of what that will look like.
We've asked for the ability to manage this crisis in a way that will have the least amount of impact to our workforce. Traditionally, when you go forward to the legislature in this situation, you go over with a number and you go over with the positions and they abolish the positions. We could do that, but we would rather get the authority, look at each circumstance that's happening moving forward, sales tax payments, updated spending forecasts, will there be federal help, will there not be, and make decisions based off of that. Certainly there's going to have to be some disruption to the workforce because the problem is this serious. This is not just a end of 2020 problem. We will not grow back. We will take a $20 million cut most likely in next year's budget as well from the state. And then we will not get back to $40 or $50 million in sales tax right away. We're talking about a 36-month problem here related to finances. So the reality is if we get federal help that we don't and really anticipate seeing soon, that will be good news. That will mean less disruptions to the workforce. So we're asking for an approach that allows us to give us time to weed through the unknown so that the most limited amount of families are impacted by this as possible.
But when you measure in hours, does that mean you'd cut people's hours and keep a part-time
No, when
position?
these are elimination of hours. So there's ideas about we've months ago the union came to us with some concepts about different furloughs. Those wouldn't work for us at the time. My understanding is they might have reached out today to have more conversations. We're happy to have conversations. Certainly, we'll look at furloughs for management confidential and department heads, and myself included, as part of any of this. But the furloughs don't solve this problem.
But going after in terms of hours, I'm just hoping to clarify why that's different than the full job positions.
Because I don't want to eliminate. That gives me the ability to cut up to 150,000 hours. It doesn't mean I will. If I get good sales tax data in, and it looks like we're going to get $2 or $3 million more than what we projected to make that decision, you cut less hours, which means people. These are human beings. So, or you go and you just cut it all now, and then, bring back 2 months. I mean, you could do it that way, but hopefully it's unnecessary to get to that number. But right now, that number represents a budgetary number in our fiscal year 2020 that we know needs to get filled. And we've already used fund balance that we need, and we'll already have to use some fund balance next year. So rating your savings account down to zero isn't an option.
Ryan, are furloughs more complicated because the county retains some expense for health benefits and that kind of thing?
Correct, and they have to be negotiated across bargaining units, and it takes time, and it's time that, again, I'm not ruling out any sort of furlough conversation. The early on furlough conversations that just weren't workable, and certainly we were all on the same page that the federal government would hopefully step in, and they led us to believe they'd step in too, and they haven't. So here we are. This isn't, our workforce hasn't done anything wrong. They performed, many of our departments have performed better than any other department in the history of our government. So, this is just the reality of where this lies today. We're out of time, and we need to find money to balance our budget. When you're facing, again, we've already done so many things. We're facing a $20 million cut by the state of New York, to their services. And they'll say it's because we've lost revenue and the feds haven't billed us out. Okay, well, you're cutting us, you're cutting our health department, you're cutting our social services, you're cutting our probation, you're cutting our children family, you're cutting our emergency management. That's the reality. So I don't know what else there is. Furloughing to hit this number would be probably more draconian than doing layoffs to a targeted amount of folks.
Are there any other options? I saw a headline today that Mayor de Blasio in New York City was going to try and get a loan from the state to delay layoffs down there.
Yeah, so borrowing your way out of a 3-year problem probably isn't something we're comfortable with. Now, what his problem looks like is a lot different than ours. So they can't even go eat a meal inside in New York City right now. So what's happened there is different. But he wants to go get special borrowing authority from the state of New York to essentially borrow his way out of what are massive layoffs down there. We're talking about surgical things here to get us through 2020, and hopefully many of these positions we would bring back in 2021's budget. He's talking about 22,000
I know
positions.
you're not speculating yet which departments, but in terms of how people using these services will see it on their end, do you see county park programs being eliminated, like anything lights on the lake related? Do you see construction? I know the season's ending, but any changes? Like what is the first or biggest ways people will see this, who pay taxes, who rely on the services?
So we haven't come up with a overarching strategy on impacts, but there will be service levels that people will see. And the reality is that how do you make those decisions? Whatever is supported by the general fund. The general fund's the one with the hole, not the sewer fund, which is water environmental protection, so they get the revenue differently. Sewer unit charges pay all the services in that fund. General fund's different. So lights on the lake, probably not, because it doesn't cost us a lot of money. It's a public-private partnership, but there are services that people like that will be impacted in 2020. And unless something happens with the federal government. I saw the White House put a bigger number on the table. I don't know if anything happened with that, but even if that number comes through and it's not enough, there will still be impacts this year. This is a 3-year problem. We can't drain all of our resources in year one when you have to deal with this for the next 2 years in addition to 2020.
What number would fill your hole entirely?
At this point, we're a $40 million number in 2020. It puts us in a sustainable position to a degree to get through 2021.
What did Monroe County get in the stimulus?
I believe they got over $120 million. And that, Andrew, to that point, if you look at our challenge with this virus moving forward, if insurance companies are pushing back on asymptomatic testing now, which they are, the CARES Act, if you look at all these, you heard about the state saying record numbers of tests over the weekend. That's because CARES Act funding is going and just covering these costs. So the regions that have CARES Act funds are able to do more testing, which drives their infection rates lower. And so you look at Long Island, you look at Western New York, you look at the Finger Lakes, you look at the Hudson Valley. These regions all got big counties that received CARES Act funding, which is helping New York City, helping them drive through because they're doing thousands of tests. And so were we. So now what you're seeing with us is you're seeing, our ability to do asymptomatic testing isn't there. So those are folks that have a higher probability of not having the virus. So we even have those pressures on our numbers, and our numbers are still holding strong.
Have you talked to the sheriff's office at all about kind of overtime and stuff like that to help with?
Yeah, our sheriff's budget is so far under budget right now that they've done everything they've needed to do. It's out of our 460 positions that are being held, I think there's over 100 in the sheriff's department. And so when you look at it, how much more, blood can you squeeze from a stone, right? So the ability to tighten the belts isn't from a line item side really isn't there. I mean, there's a couple variables. Your variables are economic impact, your sales tax, what does the feds do? Other than that, we will look at strategic furloughs related to management, but we'll see what else the union has to come up with. What they brought up months ago wasn't something that moved the needle enough. So here we are.
What departments have a little more blood to pull from the stone?
There's no blood. It's not. So you're not. We already have almost 20% of our workforce not even showing up to work because I haven't been able to fill the positions. So these are all positions filled last year. So there's not. This is just. This is what it is. And
do you see health department layoffs?
We'll try to avoid that. We'll try to avoid public safety, but that puts more pressure on other services.
Is Onondaga County getting any help now from New York State with testing?
We've not. We got one grant that I've asked. We received a $1.8 million grant, I think about a month ago, that they only released $800,000 of it to us. I don't know how that works. But we've asked that they gave that to us, telling us to go do more contact tracing and a little bit of money maybe for flu. We've asked them to release that to allow us to just do testing with it. Essentially, that represents maybe 18,000 tests we can go do asymptomatically in the community as we see fit. So that's going to be the real challenge. If you want to talk about finding hidden pockets of the virus, which then inevitably keeps your numbers low, you got to do the asymptomatic testing, or else you're just testing sick people or people who you have reason to believe COVID has been in the buildings, nursing homes, hospitals, first responders. So if you do that, you're never going to keep your rates that low. That's why it's important that all the tests in the community get counted to give the macro level picture. And hopefully soon the saliva tests will start being counted in our numbers as well.
Because there are so few people sick, symptomatic testing has got to be a very small number compared to the requirement. Because of these financial constraints and now the insurance companies not covering asymptomatic testing more often, do you see the ability for this county to test starting to dip?
Well, we think that there's resources still at the federal level that have not been dedicated, already in the CARES Act, and the state has some resources they can be helpful with for us. Yeah, unfortunately, the insurance companies they've done very well this year. They're all non-for-profits, right? You know, we all know that, right? And they're going to have a very good year because for about half the year, people couldn't have surgery and they couldn't get preventative treatment. So very disappointed in the position that they've taken related to asymptomatic tests. The ability, if we don't, Andrew, what's going to happen is right now the virus is weakened from where it is. So even with your symptomatic folks, you're going to have a lower test rate than what we had in the beginning of this process, 8-9% in the beginning. It's lower than that now, but when you're using one way in one data set to monitor the community's progress, especially when you're talking about restarting an economy, these are the challenges that you have to stay on top of it. We don't want to go backwards. Very nice being in downtown Syracuse. Saturday I drove through, a lot of activity, saw a lot of young faces going to restaurants, doing things. We've worked very hard to get to this point where these businesses can get this stimulus. We don't want to go backwards. So our region, unfortunately, has been treated differently with funding opportunities. So it's harder for us to stay on top of it than these other areas that are drawing on hundreds of millions of dollars of CARES Act funding to do testing.
Is the general public going to start getting saliva pool testing the way the colleges have been?
Yeah, I think we're very close to seeing Upstate's test being approved at the FDA level at some point. I think I know they're asking for that, but I think that if you have not the pool, but you can do a single saliva test, once that happens, you'll see that being an option as much as diagnostic. I think probably a more affordable option.
Do you have any idea what that generally costs if you do it on the individual basis?
I think somewhere between $15 and $20. You know, so a lot cheaper.
Do you have all your testing machines that you ordered? Are they all set up and going?
I don't know, Dan. Dan, did we get our second Ronix machine in? Okay, this week. I believe it's commissioned. The first one.
Is your wife going to get a back-to-school COVID test for the Beeville?
Kate actually got a COVID test last week, so I don't know if she's going to go again for Beeville. Maybe we'll send her out there for it. But she obviously was negative.
You're quickly ticking off family members to get tested
Everybody,
before you're up.
Exactly. They're very supportive of their county executive, and they are all getting tested. Now, the saliva test is one, Trish, that I'm really looking forward to having that be approved, so I can get that. So your questioning can stop on this line.
Have any teacher pools come back positive?
None yet. Should be getting JD's CBAs, the Friday ones, today. So over the 500, we've had no positives to date.
Ryan, you mentioned that your data on tests is better than the state's.
Mm-hmm.
Can you start giving us daily test numbers then?
What we're going to start doing is pooling. Again, we're hopeful the state will take the saliva tests into the Eclair system, but we're giving the report does each day on our website. We do give the daily diagnostic tests and the positives. Our positives are always a little different from the states. Some of that's timing when they report out and we report out, but some of it is just on their reports they attribute and mistakes are made. Should have gone to Oneida County, not Onondaga. And so we always have, that's the reason why we give out our own data every day, is because it is different from the states. Even if you added up the states' cases today and divided on their 7-day average for us. I was like, this looks weird. I added up the amount of cases they had plus the tests that they had, and it was actually, the rate was actually lower than what they were even reporting. So we give out our own information because we know it's right.
But you used to give us not only the positive cases, but the number for the day and of negatives.
Yep.
And,
Yeah, I believe on our health department website we do that every day, is the total testing number for diagnostic, and now we're doing the saliva, right? Saliva is going, yep. So the saliva, we talked with Dr. Gupta about that last week, is that we want that going up. So that should be up each day on our health department's website.
What have you talked about with the control room recently?
Yeah, we are hopeful that right now I think back to school has been a focus. You got colleges, that was a big focus. Now we got to do something with our hospitality industry. So that's what we've been trying to figure out, ways to get the state to move on that a little bit. Weddings are not happening because people have more than 50 people they want at a wedding. There are businesses that are that took the PPP loans, hopeful that at this point they would be able to really start to see an uptick in their business, and they haven't. And now they're having to go from lay people off now. So this is a real issue. And I know the state has appealed Judge Sotheby's ruling. They got to stay on it. But we got to figure out a way to, yes, with more regulation, if that's fine, but give businesses an opportunity to show that they can do this safely. Every time we've gone through this in all the other parts of Restart, we've been pleasantly surprised with the results. And I get that there's been cases at weddings. I believe there's been over 6 million cases in the country at this point. There's been a case for every single industry, including elected officials. Just because elected officials get COVID doesn't mean that they don't still do their job or it's too dangerous to do your job. This is a virus, so it's about how we can mitigate risk while still living with this. So I think that's the big thing with what is on the sidelines. I know movies, I think the governor's talked about that. I think he hinted maybe that he might do something with some of the upstate casinos. But if you want to talk about how to get the unemployment rate down, and you want to talk about how to get some economic activity, getting hospitality increased is the way to do that, in my opinion. Anything else? Well, again, thank you, everybody. We will see you on Thursday. And again, 3 to 7 today, Prevention Network. You can get trained and